This work has been really pioneering, particularly foundational, conceptual, and empirical work on energy and security, as well as concrete community and policy interventions to advance energy justice. Excitingly, much of this work and new work is brought together in her new book, which you can pre-order now earlier. And it's also put into practice working with municipal governments around the country. As you might imagine, on a personal note, her work has been inspiration to many of us, especially working in housing insecurity and climate change, health equity. And part of that is a commitment not only to groundbreaking research, which she has done in spades, but also to the humanity of people living health inequities. In doing so, she reminds us our work in public health is not an abstract exercise in improving health statistics, but rather a fight for human dignity. Please join me in welcoming Dr. Hernandez.
Thank you. I feel like this is like a homecoming in many ways because I just see so many familiar faces and have been in the orbit of especially the Urban Health Collaborative for a long time. I want to just start this talk in gratitude and also in honor of Ana Diaz-Rue, who just has been a real pioneer and a role model. And I just see what you've built in the Urban Health Collaborative, and congratulations. And really kudos to you and to the team and to the group. And, you know, I know you served as dean for a very long time and in the midst of a lot of crisis. And so thank you. Gabe, thank you so much. You are the next generation. And I also admire your work, and I really do see it as also being kind of at the frontier of a lot of work, and a lot of the work that we do should be in communities and applied and practical, and your work really exemplifies that, so thank you. I often, and now I lean into it even more, talk about myself, and I talk about myself not in research terms, but in terms of how I grew up. So I grew up in the South Bronx and in Section 8 housing. And housing is such an important part of my worldview and development. So of course, it's probably not a secret that it would be so important for my research, but this is reminiscent of like basically the environment that I grew up in when the Bronx was just kind of in shambles. The building that I grew up in, and then a condo that my mom bought. And when I was in college, that's where I lived. When I was in urban school at Hunter College. And then I went on to Cornell, where I studied sociology, and I happened to also like buy a condo at the same time. And I didn't necessarily know this, but I did fall behind on my utility bills and I got connected to energy assistance services at the Cornell Cooperative Extension, where I was also enlisted in weatherization services. And little did I know that any of these things would actually be so relevant for my career. But I think it has been important to live some of the truths to be able to then understand what those dynamics are like. And then I did a study before my dissertation project was in Dorchester, and it was about medical legal partnerships at the Boston Medical Center. And it was there that I was doing in-home, in-depth interviews. And I was understanding aspects of housing that I was prepared to understand and see and observe, because it was about lead and asbestos and crowding and mold and you know, kind of chaotic environments. And then there also happened to be this other thing about people like living in cold homes and being shut off. And that's really what kind of started me on this trajectory to look at the intersection of energy, housing, health, and equity. And over the course of my career, this is a little bit of a full circle moment, because several years ago, I also gave a talk when my work was like a little bit more nascent, and it was like still developing. I think it's come a long way, but a big part of my contributions to academic research have been in conceptual frameworks and offerings of understanding social processes and social problems, and really, around the four pillars of housing, around energy insecurity, around energy justice, and really looking at the socio-environmental determinants of health as kind of combined. And then really thinking about recognition and action to close gaps. I've also ventured in my spare time into housing reconstruction, and those development projects have been really instructive for me because they teach me, first of all, that housing conforms to your vision. And that to me has been such an important lesson in what can happen in the built environment. And also on the operational side, what it takes to basically have, targeted interventions in the housing types, like the 2 to 4 family homes, like the row homes here in Philadelphia, that actually need the most attention. They need the most investment. They have the most potential for incorporating clean energy. But it does take a lot to go from that. Is this a pointer? Do we have a pointer? It does take a lot to go from that to this, which is actually like the before and after of my third gut renovation in one of these homes. But it's also been about an anti-brain drain or brain gain for people that are educated and emerge from communities of need to be able to be in service in a much more tangible and practical way. So over the course of my career, I've done the hard work, both really like academic and, like the sweat equity. I know about hard hats, like construction. I used to go to my office with like sheetrock and construction dust on my clothing, and hardware, right? Like this is a boiler that I'm sitting on a hot water heater in front of my properties. Of course, it was like a photo op moment. But more seriously, also hidden hardship. And I think it's actually been, so I now understand myself to be a highly sensitive person. And that designation has helped me not to cry in professional settings. Otherwise, like sometimes it's, but anyway, the hardship part is about having an emotional connection and understanding, like just certain things and just being more attuned to them, but also maybe a little bit more sensitive to their meaning. And this is just one example of the many that, like being a person in a community of need, as a person with privilege and a voice, that I've been able to exercise the witnessing of certain things and contextualize it. So this was a fire that happened in 2022. It was one of the deadliest fires. The New York Times and the press coverage talked about the malfunctioning self-closing doors and no exit and the kind of chimney effect that happened in the stairwells. But at the root of it actually was a space heater that was on incessantly. And I used my platform to write an op-ed where I situated what happened in the context of the data, much of it actually produced by the city government, around no heat complaints and this persistent issue in the lack of thermal comfort and the need to resort to things like space heaters in the context of the broader phenomenon of energy insecurity. And I just want to kind of situate this work and say just read this out loud, which is that the misery and fatal impact of inadequate heat and poor housing conditions that Bronxites face must be recognized for what it is: a predictable harm and a preventable wrong. Beyond greater fire safety messages, the takeaway from this latest calamity is that Bronx residents deserve to experience energy security, thermal comfort, and dignity at home. And that's been, as Gabe kind of alluded to, like dignity has to be a core part of how we think about our long game and outcomes in public health. So I'm going to talk about the work that we've been doing to document energy insecurity in one city, New York City, just given the urban focus of UHC. And then I'll talk about what that looks like at the national level. I just want to also work backwards and say, like, why do we care? Why should we care about energy as a public health issue? And I always like to kind of caveat that, you know, this is an overlooked issue, but it's not inconsequential. We are much more reliant on energy. Its uses have varied and expanded over time. I mean, I don't have to remind you, but I will, that we use energy for heating and cooling and lighting and refrigeration and food preparation, the use of technological devices and medical equipment. So when the lights are out for different reasons, it is really disruptive, but it could also be much more consequential than that. Most of us are interfacing with energy, well, after, you know, like in adulthood, I guess, around a bill. And the truth is that the cost of energy has increased, even as with efficiency, our consumption has decreased, but the bills are nonetheless skyrocketing. And when energy intersects with poverty and inequality, at the core of it, people are suffering. So my work, which started as part of my dissertation several years ago at this point, it was a very generative study, it was to define and operationalize the concept of energy insecurity as kind of having three dimensions: an economic dimension, which reflects the kind of disproportionate share of household income allocated to utility expenses; a physical component, which has to do with housing deficiencies and inefficiencies that impact thermal comfort, induce harmful environmental exposures, and also increase energy costs; and then coping. So, I mean, we have to assume that people are managing their circumstances, be they kind of economic or physical in nature, but people are actually taking actions. And that coping dimension actually gives credit for the agency that people have, but also kind of like helps us to understand what are those trade-offs that are being made as people manage these circumstances. So I'm just going to share the results of a citywide survey that we did in partnership with the New York City Department of Health and Mental Hygiene. It was published last year in Health Affairs, where we kind of documented energy and health-related issues in New York City. We had a representative sample of 1,950 adults. This was administered in 2022. And part of the kind of research offerings here is to kind of zero in on some indicators of energy insecurity. Like, how do we make sense of a multidimensional and complex social issue, a social environmental issue? What are the kind of ways that we pick up on it? And so we landed on 10 different indicators, the home being too hot or too cold, representative of the physical challenges, difficulty paying utility bills, debt in excess of $100, a disconnection notice, actual shutoffs due to non-payment, not using an air conditioning unit because of run costs, not using heat because of run costs, using a stove or oven for heat, or reducing energy use because of the cost. This is the distribution of these indicators in this representative sample of New York City residents, the most common of which was reducing energy consumption because of cost, followed by the home being too hot, which interestingly enough actually happened in summer and in winter because many buildings in New York City are overheated, which is also kind of a problem. But also that, over 25% of New York City residents report their home as being too cold, which might lead them to be then using their space heaters for heat we found that over 20% of New York City residents have difficulty paying their utility bill, as reflected by the fact that they had a late or missed utility payment. Then you see that like the progression of these economic challenges does land on disconnections, but for far fewer households. So when we look at disconnections as an extreme case, it really is kind of the tip of the iceberg, so to speak, because it's the underlying economic difficulties where we could do more of the preventive work. We know that just under 15% of New York City residents are not using AC due to costs. About 7% are not using heat, but over 20% of New York City residents report using their stove for heat. So we can all imagine the many challenges, and I'll get to the use of gas stoves a little bit later. But of course, when we think about the distribution, and I know this table is busy, but I just wanted to show you that we looked at energy insecurity and defined it as households that had 3 or more of those 10 indicators. And using that, we found that about 28% of New York City residents are energy insecure, and that the usual suspects of inequality appear: race, renters, recent immigrants, households with children are all more likely to experience energy insecurity. But from a health perspective, people experiencing energy insecurity are more likely to also be in poor health, and that's also across different domains. So these are adjusted odds ratios of people with these different conditions, right? So cardiovascular disease, mental health conditions, respiratory conditions, and the use of medical equipment. So the medically vulnerable are more likely to experience energy insecurity, right? Which I think is an interesting way of thinking about protections for the medically vulnerable. We have a complement to that, the citywide survey. We did in-home interviews, and we have censored data and survey data at the household level. But what I'll be showing in the next few slides are actually the work that we've been doing on the dissemination side, and kind of new methodologies for talking about a more hidden issue in a public space. So that was developing a methodology around street intercept interviews, and also establishing Hot and Cold NYC, which to date has about 300,000 views and impressions, having been launched a little over a year ago. And so it's a group of students. Our Hot and Cold team are mostly undergraduates or recent grads that are social media savvy, like know the lingo and like how to connect with audiences. And we give them full latitude to like create content. And so I just want to share with you, I showed you the statistic, but let me show you what we've been doing on the dissemination front. No. I don't think we have audio. Sorry. Check us out on hotandcold.com. We're on YouTube, on Facebook, on Instagram, all the things. Sky. So what was in the backdrop there were the home-based interviews. So let me just tell you how we got here, because it's an important way of us thinking about moving the field forward, and also moving beyond our traditional dissemination techniques in academia. So alongside the IRB approval that we received, we also did a media release form that was actually developed in conjunction with our communications office, and then reviewed by the Office of General Counsel and the IRB, so that participants signed off on not only doing the interviews, but also allowing us to use their likeness and or their voice for social media purposes. And this is important to me because it helps us to again, put a face on our participants. They want to share their stories, they're willing to do so, they understand that that's kind of a condition of participation. And for us in public health, it allows us to do this work around reaching broader audiences by having content that is based in communities and in the work that we're doing. So these are our students also in the field, literally putting a mic to passersby and asking them about energy issues. And we think that that's an important strategy, I think topically for this issue, but also in general, I think can be instructive for the field. All right, I'm gonna keep going. I wanted to talk about clean energy and where New York City is on clean energy, because the survey allowed us to look at a lot of the problems, but also like, what are the possibilities? Like, where are we going? We know cities now have huge goals and targets around clean energy. A lot of that would be beneficial from a public health perspective, but what our research actually shows is that we have a long way to go. So we asked about two specific dimensions of clean energy adoption: rooftop solar and non-gas, like electric stoves. And what we found is that 86% of New York City residents reported using gas stoves. And that only 14% are actually interested in switching over to electric stoves. And the households that were least interested in converting were actually the ones that faced kind of the less financial barriers. So they're the more privileged New Yorkers, whereas energy insecure households were actually more hopeful about both clean cooking and also solar adoption. So 5% in our sample actually had solar, 77% were interested, but they talked about the lack of control, the confusion and cost as barriers to adoption. And only 1% of New York City residents actually have both solar and electric stoves. So we have such a long way to go. And some of that is actually about shifting preferences and, kind of trying to understand where this control, confusion, and cost might be barriers and how to overcome them with things like community solar subscriptions, which would allow people to have access and participate in the clean energy economy, but not necessarily have that on their rooftops. Think about building residents, right? Like, and even if they had it on their rooftops, like, are they actually benefiting directly from it? Not so much. So now I'm going to get into the contents of my book, my new book, Powerless: The People Struggle for Energy. And this is really the story of energy insecurity in America. And sorry, I wanted to say that, I've been doing lots of work around the country and not so much global work, but definitely and just seeing in different studies about different issues, like when public housing converts through the rental assistance demonstration program, a lot of the capital improvements have to do with household energy. In Puerto Rico, the stacked environmental issues and financial and social issues, really are showing up in particular ways. So I've done lots of projects where these environmental and energy issues are showing up, but I wanted to be intentional about devising a study to capture this. So this is a mixed method study, 100 interviews with impacted households around the country, in and outside of the energy assistance orbit. And I'll talk about that shortly, but also 2 national surveys, one from the government and then an original survey, and really landing on an action framework. We could be very descriptive in our work, and research necessarily provides insights into issues, especially that are more hidden. But if you're an impacted person, or just you're caught up and now you've learned about this, the so what and what do you do about it? We wanted to package that into the book as well. So Powerless is a follow-up to the work that I done in Dorchester, which was, you know, the way that it's framed in the book is an incidental finding, right? It was like you go for an X-ray and you realize actually like you were looking for one thing, you come out with something else, but like how do you follow up on that something else? And that's what this book is. I want to say that it was a real honor to work with Jennifer Laird, who's a social demographer and a sociologist at Lehman College at CUNY. We met when she was a postdoc at Columbia and have collaborated and walked through this process. Although I was the one to initiate the study, we ended up writing the book together. Lonely process to write a book if you ever have thought about it. Let me tell you the real like personal motivation for this book, right? I already told you who I am, some of the work that we've done in cities, but in meeting people around the country, like there were just like constant reminders about why doing this work was important. And this is a real picture of a real letter that was half written to a utility company. And Miss Betty, who I met in Alabama, was just frustrated by her winter and summer bills. It was September when we met, and she was like, listen, you know, like I barely turn on the air conditioning unit. I do everything. I take off the water heater. I'm doing all of this and I still can't keep up. And she said, Diana, I started to write this letter. Can you help me finish it? I just want to send a letter. So I helped her like complete the sentences. But this book actually is the letter. Like it's the longer form of the letter. So that other people, not just a utility company, but everyone can actually better understand the circumstances of someone like Betty and the millions of people around the country and around the world that she represents. And this work is very narrative based. And I started practicing narrative techniques as Gabe reminded me, and using like a case study approach, which is very common in medicine. But how do we extrapolate learnings from stories? And ultimately, what this book does is, again, kind of going in deeper. It includes the dimensions, but then it also like starts to identify the measurable indicators of energy insecurity. So these might sound familiar. So this book, actually the work happened before the work that we did in New York City, but I was able to publish the work in New York City before this book came out. But anyway, so difficulty paying, utility debt, disconnections on the economic side. These are the essential elements of energy insecurity. The physical dimension, deficiencies and disrepair. So like the dated and dysfunctional energy systems and appliances that exist in a home, inefficiencies, so drafts and poor insulation, and outages. We don't often think about outages as part of like what would make up energy insecurity, but we know that outages are very consequential for survival, but also for underlying health. Coping dimension, so really kind of trying to narrow down how we think about coping dimensions to the most essential. So difficult choices, discomfort and danger, and deprivation. And deprivation really reflecting underconsumption of energy to save, right? And sometimes like there are real environmental benefits to that, but there's a downside to not using enough energy for health and safety. And just like we have ways of describing food insecurity in this visceral expression as hunger, and in its extreme as malnutrition, this book also offers up drain and depletion as ways of understanding that visceral feeling of energy insecurity. In like the fact that people's literal energy is drained when they're in homes that are too hot and they can't move. But also that if the circumstances are challenging enough and chronic and intense, that it can have a depleting effect and expression. So I'm gonna go through the examples like a little bit more quickly, so that we have some time for Q&A. But this image alone really kind of depicts what it is, right? The difficult choices between paying a utility bill and other basic needs. And really, like, in speaking to 100 people around the country, I can tell you that much of what was at stake and what was being decided upon was basic, right? It was as basic as a new pair of shoes, not for vanity's sake, but for necessity. And foregoing that to privilege a light bill and avoid a disconnection. And this is where we landed on looking at those the indicators. So we kind of landed on conditioning the prevalence on having an economic expression of need. So with the residential energy consumption survey, which is administered by the Department of Energy, the Energy Information Administration every 4 to 5 years. So it's totally infrequent. We'll get to that shortly. The only kind of economic indicator that they have is disconnection notices. So premised on that, we basically show a prevalence rate of about 10% having that economic indicator and any of these other issues. But we also find that for households that don't have an economic issue, those are what we call the kind of at risk, because it's like many of us around the country, one paycheck away from a financial crisis, one trigger or shock or something that kind of throws off a household budget, and they too can like be part of the energy insecure group. So 10% prevalence is not unlike diabetes or cancer. And yet energy insecurity, or food insecurity for that matter, and energy insecurity just doesn't get the attention. So this is a very conservative number, but you can see that even in the most conservative ways, when we think about impacted and at-risk groups, we're talking about 1 to 2 households in the US. And we're actually talking about millions of households. So we can talk about this, this crowd would appreciate prevalence rates, but what we're really talking about are millions and millions and millions of households around the US, about 33 million that have any one of these indicators at any given time. And just like the patterned inequalities that showed up at the city level, we see the same thing happening at the national level, where race and income and households with children, people living in mobile homes, people living in older buildings, renters, people living in rural areas are disproportionately impacted by energy insecurity. And from a health perspective, I showed you the New York City data where people living with chronic illness or different conditions were more likely to be energy insecure. In this book, we actually show that energy insecurity shows up as a predictor. Various health conditions, so high blood pressure, heart disease, diabetes, asthma, cancer, are very regularly statistically significant as predictors of energy insecurity. But that ability to afford food, the use of medical devices, mental health, respiratory health, and sleep are also impacted by energy insecurity, particularly for people that have the multiple forms of energy insecurity all at once. And this might not be so easy to see, but the message is really clear. There's just really consistent ways in which people are impacted. And from a health perspective, sleep actually, probably not surprising because of its mental health and kind of physical, environmental factors that impact it. So these are the different places where I did the in-depth interviews, and I did the in-depth interviews myself around the country in 2018, including here in Philadelphia. And I just want to acknowledge Sam Rivera, Doctora Samantha Rivera, who is an alum of the Drexel program. I met her when she was an MPH student, and then saw her all the way through, and really excited to see you arrive in your own professional space, but also really grateful. She's actually in the acknowledgements of the book because she opened the doors at Congreso here, local, Congreso de Latinos Unidos in West Philly? North Philly, where the Latinos are. And I was able to do interviews in the waiting area at Congreso, and to understand, in that case, emergency relief for people that were experiencing disconnections. So that's what I was talking about, being inside and outside of the energy assistance orbit. So that, I was in waiting areas at energy assistance offices, but also went to legal services here in Pennsylvania. Actually, later on today, I'm giving a talk at Community Legal Services because they too helped me to link up with some of their clients who were experiencing, shutoffs or needed like longer term shutoff protection. At food pantries in Puerto Rico, at a disaster relief organization following Hurricane Maria. And in Arizona, Michigan, Montana, of course, in the Bronx, in New York, in Memphis, Tennessee, and in California, I was linked up with this organization that was doing utility reform, the Utility Reform Network, mobilizing groups around the country, and also did a homelessness prevention organization in California. And in Texas, the goal there was to look at, gas communities, like frack communities, and the ironies of like being in an energy production environment and community, and also like still having trouble meeting your energy needs. And in Alabama, where they were fighting for energy democracy and representation on the boards of rural electric co-ops, so that they could be reflected in the decision-making around rates and other things. This is the story of a woman that I met, a participant that I met in Detroit. And she was, I met her at an energy assistance office, and she was explaining what was going on in her home. At that point, she was cut off from her gas services due to a safety issue. So not necessarily about affordability, although she was at the energy assistance office to keep her electricity on, because that was the only thing that was like kind of keeping her going at that point. And she reflected and she said, I thought I was the only one living in an unheated home. And her pipes froze. She was using a 5-gallon, those like the 5-gallon things that you put on the filter or whatever. Like that's how she was like getting by with her water needs. She had no running water at that point, and no gas, and a pending shut off for her electricity services. And then she saw this news report of another woman also living in an unheated home, and she said, you know what, like it was important for me to see this because it helped normalize to a degree that I'm not the only one. And again, I mean, I can go into all the different ways in which this book has like lots of tidbits, but like for me, kind of getting back into this idea that this is a ubiquitous issue, though it's hidden, and it's sometimes in the media where we start to see, the stories about this. But let me get back to this other, so this is her actual home. Part of what I did in doing this, like the story development, was to look at Google Street View and Zillow and like run the addresses so that I had a little bit of a sense and could describe realistically, what these homes look like. And it happened to be that in running one of those searches, I saw this home on the market. And the long story short is that the home it's a family home. It was basically paid off. There was no mortgage on it. But somehow at the end of the story, she's displaced from her home because the amount of work that was necessary was well beyond whatever weatherization assistance might be able to provide. She needed like a HGTV kind of big renovation. And that's what it said in how it was being sold. And that to me is a reflection of the kind of investments and how do we start to think about how cities could be much more involved in creating pathways to free, intensive, deep retrofits to keep people where they are, addressing both the energy insecurity crisis and the housing affordability crisis and issues of displacement all at once. One of the things that's kind of interesting about this work is thinking about the health of our buildings and how the health of our homes, if we look at it just from the perspective of physical energy insecurity indicators, is either stagnant or worsening. And that to me is also about like thinking about how we need to reinvigorate our housing stock so that the homes that people are in are more livable. I think especially from an equity perspective, because this is the downside of not doing that. This is a woman that I met in the Bronx, and she basically skipped on using heating in her home. As an older person, her greatest fear was not having a home that was comfortable enough where her family would come and visit. So we know social isolation is a public health issue, and yet we don't often think about the ways in which our homes are uninviting and therefore unable to host those social interactions that we know to be so critically important from a public health perspective. But also that then this idea of skimping and depriving oneself of adequate energy use might render homes smaller because you can only use your home one room at a time. And it also means that people are resorting to the space heaters and the ovens and the stoves for heat, thereby, again, shrinking the space. And thinking about that agency aspect, the coping components, what we know is that people that have no physical or economic indicators of energy insecurity are doing very little, so no measurable coping. But by the time they have both physical and economic indicators of energy insecurity, they are what Arlene Geronimus calls high effort coping, right? They are doing everything that they can, finding energy assistance, foregoing medicine and food, keeping their homes at an unhealthy temperature, often in combination because of these conditions. Now, I'm gonna get into the energy assistance part of this because now we move into solution. So energy assistance, the low income home energy assistance program, the weatherization assistance program, these are programmatic interventions that stemmed out of crisis. So they came out of the OPEC oil crisis of the 1970s. But the truth is that they offer primarily heating and primarily crisis support, and to a very small extent, cooling and weatherization. And then of course, you know, there's issues around eligibility. So only about 20% of households that are eligible for LIHEAP actually receive it, and 0.2% of households that are eligible for WAP, the Weatherization Assistance Program, are actually receiving it. So we are talking about huge enrollment gaps, but at least these programs existed under Trump and the current political, I don't know, chaos. You know, these are issues that are on the chopping block, and I will talk about the difference between LIHEAP and receiving LIHEAP, and then having to deal directly with utilities. And they're really reflected in these two quotes. Two cancer survivors, one that goes in, actually is able to access LIHEAP, uses it by necessity to keep a warm home. And then someone who had just recently had surgery to address her cancer and was made to, like had the runaround around being able to make a payment to avoid a utility disconnection by dealing directly with the utility company, and just how dehumanizing a lot of that experience was. I'm not even going to talk about shortcomings and solutions for the energy assistance program. I'm going to take this moment to also just comment on where we are. So in March of this year, we have a rate case in New York City that will drive up utility costs by 11%. And by the next month, we have a story about the entire staff of the LIHEAP program, which was already skeletal to begin with, 14 people, administering $4 billion, super efficient. 90% of the money actually goes directly to people in need. But the program staff, where'd that go? And then just last week, the president's budget proposed eliminating LIHEAP altogether, saying that the national strategy is to unleash energy production, that it's unnecessary because states have policies preventing utility disconnections for low-income households, that it's a pass-through to utilities, that it rewards states like California and New York, and that instead they are going to support low-income individuals through energy dominance, lower prices, and an America First economic platform. And if we don't pay attention to this, we don't really understand how insane a lot of it is. But I'm an expert in this issue. Like this, hands down, I can tell you that. And I'm just gonna say that my take on it is that absent a robust energy safety net, eliminating LIHEAP is an assault on the dignity and survival of millions of Americans, and it's tantamount to cruelty. When you also think about how limited it is to begin with, and when it shows up, when people are actually turning to energy assistance, and that not only will more people face unpayable utilities and extreme indoor temperatures, but almost 3 million households in the US risk being without electricity at all. I think we have to ground ourselves in that. I do feel like most people that are in leadership now are thinking about ways in which this moment constitutes disruption, often is an avenue by which innovation and alternatives surface. And so I want to stay hopeful in that. But I think we also have to be grounded in the reality of this practice around disconnections, which is not evenly distributed around the US. But anybody that experiences it would understand it to be inhumane. And directly from a participant's description, she talked about living through a utility disconnection as having to savage it, meaning that she could only use her home as basically an overnight stay, but operationally she couldn't do anything, not feed her children, not bathe them, not operate in their home despite having a home. And she was really nervous about whether or not that constituted a violation of her lease, thereby, also inviting the risk of displacement. And let's not forget that the lack of energy actually is deadly. And these are turning back to media coverage about different instances in which the lack of a utility service landed on a home that was extremely cold and where its inhabitants basically perished, and including what the New York Times called totally preventable, a disconnection for a medically vulnerable person in the context of extreme heat. That happened and landed on a new law in New Jersey that basically bans disconnections around temperature and around the health status of individuals. And lest we forget that climate change is real. When it intersects with vulnerability, it presents all kinds of hazards. And that we have rising temperatures, power outages. we have an energy infrastructure that actually needs attention and it needs investment, and who pays for that? And when we have, our energy policies that are really designed and rates that are structured around being equal, it often means that the impacts are deeply unequal. And we have lots of barriers to electrification and clean energy access, as I shared before. So in Puerto Rico, losing the power was just the beginning because it was a months on end ordeal. And in this chapter of the book, I talk about appliances, and that being kind of the vehicle by which energy is actually in a more usable form, but really compromised by the lack of reliable energy. So as we kind of reimagine futures, right now we have broken umbrellas. We really need to be thinking about, or we have broken safety nets. We could really be thinking about sturdier umbrellas, and that's an analogy that I use in the book. But this is the action framework, and it's meant to be simple because it's meant to be actionable, and it's really like the umbrella. This is the umbrella, right? Like this is kind of the comprehensive coverage that we need to make more sense of energy insecurity. So it starts with data. We have really this kind of lack of data availability. And there are many avenues for, like thinking about that, including public health surveillance, participation in energy assistance, affordable bills, a robust energy and social safety net, knowledge as reflected by energy literacy, efficiency, electrification, clean energy access, and disconnection reform. And I can't go into all of this, but I wanted to say that if we get it right, eradicating energy insecurity will deliver social and environmental benefits around emissions, efficiency, affordability, access, health, wealth, and democracy. And on human terms, it looks like comfort, health, dignity, connection, community well-being, and security that redefines resilience. And the end goal is really reimagining our energy and climate futures to end needless and asymmetrical human and ecological suffering. And so with that, I'd like to thank my team. I have two teams that I love so much, and they help me so much at Mailman at the Center on Global Energy Policy. Follow us on Hot and Cold if you care about understanding people's stories and lived experiences, and read the book. Happy to take a few questions. We don't have a lot of time, but yeah.
Thank you so much for this. I'm so excited to see that this is what came of all that work, and thank you for the acknowledgement. I grew up in an overheated tenement building in East Harlem. I remember the windows always open in the wintertime because we had to cope to the point where like me and my siblings would have chronic nosebleeds because of the dry heat. So this really hits home. So thank you for highlighting that. I want to say that my experience at the city before I was where I'm at now, I was working in the child welfare department at the city of Philadelphia, and surprisingly, the data on child neglect reports on how many parents were being investigated from a child neglect perspective because of utility shut off was the most accurate data that the city has on how many families are actually experiencing some kind of utility issue. So oftentimes we would have meetings with like folks on the LIHEAP team or SI or James Moore's team, which was like the integrated data for the city, and ask like, can you tell us how many reports you're getting on child abuse reports because of utility? So it's like even just the concept of insecurity being now blamed on the parents and ultimately impacting their families, and separation from their children. So it's crazy.
Let's work on it. Yeah, like, let's collaborate.
And I'm sure that'll come up with the community legal services too.
Mhm.
When you talk to them, they're definitely big on child welfare impacts.
Oh, yeah. Oh, yeah. Thanks for bringing that up, Sam. Definitely. Look, I think that there are signals everywhere, but the signals aren't being kind of understood. They're understood to be noise. They're not actually understood to be something concrete. And I think part of this work is to be able to say this is part of a broader phenomenon. And rather than punishing our families with children, which we know are disproportionately impacted by energy insecurity, how do we understand those shutoffs to be opportunities for linking them to the kind of resources and benefits that are already existing, right? We have to take non-punitive approaches to dealing with fundamentally, what is fundamentally about poverty. And the expressions of poverty is like people that, like jump the turnstile, or don't pay their fare on a bus. Like, you think that's because they just are trying to get away with it? No, oftentimes it's because they can't. They don't have a way. And so, yes, that's not the first time that I hear it, because definitely, it was always a concern, but it's the first time that I hear that actually the data is so not only available, but, would be so telling. So I would love to figure out a way, maybe we can all collaborate, since I've been dancing with Drexel for a long time. Let's do it. Yeah, thanks. Maybe one more question. Okay.
We have a question from the chat, thinking about solutions. So if you could give some remarks about how this kind of work can be supported, I think either on the research or the practice side, given the political climate, thinking first at the local level up to the federal level.
Yeah, so the action framework is actually really set at the state level. So much of energy policy and even human services and that kind of stuff is really at the state level. And with less confidence at the federal level, I think it's actually going to be states and local governments and even communities where these approaches can happen. But I think it really starts local health departments, state health departments tracking this, really including it in their reporting around, material hardships, but kind of making the link to health. I think that is really critical. And we talked about that in the health affairs paper, that was just kind of one example of how these, partnerships are really important, and the continuity of the data. So that's just one example of because you can't really start along the path of solutions if you're not really measuring. So we do need a more robust measurement of this. Any last pressing questions? Otherwise, thank you so much.